Welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos, and if you are new to us, welcome. Welcome. We are super excited. You know why we're excited? Because we're having conversations with real innovative leaders that are trying to change the forefront of care delivery technology. We care deeply about access, innovation, adoption, and leadership. And if it's your first time tuning in, make sure you hit the subscribe button now so that any future new episodes come right into your inbox. And as part of our commitment to our community to keep you updated with the latest advancements and solutions within our space, we've got someone that's coming on today that it's been a 2-year road to get him to come on. Not because he didn't want to come on, but because it was more of a timing thing. It's a pleasure for me to introduce a visionary leader, someone who's a strategic thinker, an expert in the world of healthcare technology, and he's a dear friend. Luis Montes is the founder and CEO of Innova Health. Luis is bringing now, what is it, over 2 decades now, definitely over 2 decades of hands-on experience within our industry.
Don't age myself.
But he started off as a clinician, and then really maneuvered into more leading major tech initiatives within the post-acute care market space. His career has really just been dedicated towards revolutionizing the rehab therapy space through innovative approaches, not just technologically, but also process-driven approaches. We're really keeping the clinician at the forefront and the patient at the forefront. And he's played, prior to founding Innova, he was in some pretty significant critical roles at Kasamba, where he served as VP of product development, and later as Senior VP of Strategic Partnerships. And he spearheaded the technology partner selection and managed partner relations. And in his newest venture, Innova Health, it's really aimed at delivering user-friendly yet powerful technology solutions that drive efficiency in the rehab therapy and really ultimately fostering superior patient care, which is what this is all about. So, Luis, good to see you. Welcome to the show.
Thank you, Michael. And you can't forget patient docs, man.
Yeah, we go so back. And well, I mean, we can go in so many different areas. So maybe we start out with your journey, because it is such a unique one. As I noted, you're a clinician. Maybe just give a really short kind of narrative in terms of your story and what you're focused on now, and sort of your compelling reason why.
Sure. Well, first of all, Michael, thank you so much for having me on your show. I've been following your show now, like you said, for a couple of years, and you always bring such great guests. So it's really an honor to be here, talking to you, and especially seeing this show grow and evolve, and you leading it. It's fantastic as a dear friend to me. But and thank you for the kind words. That's very, very nice of you. And yes, I am very old, over 20 years in this healthcare field, but I love it. I love it. I love everything, about healthcare, about helping clinicians provide and deliver, better care to patients. I love rehab. I love innovation. I love technology. I love leadership, business strategy, and all that. So to me, it's I wake up every day and I feel absolutely blessed to be doing what I'm doing. But yeah, I did start it as a clinician. I'm a PT, a physical therapist by background, and always, like I said, love the industry, love the field, and I practiced for about 6 years or so. And that's I primarily practice in outpatient settings, outpatient rehab, outpatient orthopedics. And then I quickly got into entrepreneurship, very early on. I mean, I think I graduated with my degree, and I had my own practice within like 3 years, So that's where I really kind of delved into entrepreneurship. I always wanted to have my own practice, open up my own practice. That, became a couple of practices. And also we also did some consulting work with other centers that wanted to open up more rehab centers. So really became a student of practice management, and software was always at the forefront of that, right? Like,
were you always involved? I mean, in tech. I mean, did you always have an excitement for technology? Because it
I
just
always
seems like
did.
you.
Yeah,
Yeah. Okay.
I always loved to tinker. Yeah, I always did. I always loved to tinker with technology. I was kind of like that quintessential, geek, always, buying the new iPhone, the new BlackBerry, the latest laptop. I just always loved to tinker with technology. I always did. I didn't pursue computer science because I was more interested, in healthcare,
Mm,
but yeah, so I started as a clinician and quickly evolved into entrepreneurship. What I felt in entrepreneurship, and leadership was I could have a larger impact. So that was it, right? So I got into the field to help I wanted to help patients. I thought it was like, wow, I can make a living, helping patients, and this is fantastic. People will pay me for, helping people. But
right.
I quickly realized that if I get into a business, and if you could lead well, then you can have a
Hmm.
much larger impact. And certainly technology helped me with that, with my clinics and my practices. So
That's right.
that evolved into my deeper interest in
Mm,
technology. And then I decided to sell my practices and actually join a startup, ACP at that time, Accelerated Care Plus, right?
mm.
And watch that startup evolve, from early stage, all the way to when that company got acquired, sold to Hanger, which is where we
Yeah,
met,
that's where we
right?
met. Yeah.
And watching that trajectory and watching that group, it was a fantastic company till today. I'll say no. I don't have interest in Hanger or ACP, but
Yeah. Yeah.
always admire their culture. Always admire um, what John and Dr. Stell did, early on, and I learned a lot from them on how to drive, a culture. In fact, Tony Taylor, who's our
Yeah.
CMO,
Yeah.
was an early investor there, and we adopted a lot of that and infused that into Innova Health now. I just learned the importance of driving culture in a company, and ACP always had that, and learned a lot from that. And that really took my journey into technology even more, even deeper, right?
Yes.
With
Yes.
ACP,
Yes.
I think a technology company. And then kind of went back to my roots. I operated, in home healthcare settings. That's why I
Yeah.
learned about the
Yeah.
home
Yeah.
healthcare
Yeah. Yeah.
industry and developed patient docs. You don't have
That's right.
it's more technology, right? So yeah, that's my journey. A little bit of my journey.
Well,
And
and the post-acute setting space, I'm just so interested. What makes it so ripe for disruption?
yeah, it's a great question. So, well, first of all, it's a massive part of our healthcare system, right? And I think that over the past especially with advancements in electronic health records, the primary dive was always in acute care, right? So hospital settings, health systems, outpatient practices, and unfortunately, post-acute care just kind of got left behind, and the incentives were more aligned towards, especially with meaningful use and things of that
Yes.
nature, more aligned towards the acute care space. So I think that started there, right? Like in where we started pumping a lot of money and a lot of investment, into acute care settings, health systems, and things like that because of meaningful use, but not so much into post-acute, right? But that's been changing a lot. Obviously, there needs to, over the past 10 years, there's been a lot more innovation, a lot more disruption, in post-acute care, because it's such a large part of our healthcare system,
That's
and
right.
it's a large part where seniors are being treated and getting care for, right? Whether it's home healthcare, and whether it's skilled nursing, right? Uh, or inpatient rehab facilities or so forth. And if you think about, value-based care, it makes sense, right? It makes sense to treat patients at a most efficient setting, certainly settings
Hmm.
like home healthcare, really lend itself, post-acute care, to more innovation there, right? Because it's a very efficient type of clinical setting, right?
Right.
So I think that over the past 10 years, yeah, we're seeing more innovation there, but we're not quite there yet, right? We're, certainly lagging behind in, where's interoperability, we need more patient engagement, we need better, electronic medical records, EHR systems, right? And I think that there's areas of opportunity to improve, uh, uh, many areas of care through technology, right? There's just a lot of opportunities, right, in post-acute care and certainly rehab where we
Mm.
fit in.
So in terms of where you fit in, I mean, you mentioned about a lot of the areas where there are gaps. Like, talk through the process of maybe some of the pain points that you kind of consistently heard about, that made you kind of feel like, that it's this has to be better. Like,
Mhm.
talk us through that process.
Sure. Yeah. So, well, that's a lot of questions. So there's a lot.
There's a lot of
I
problems, right? But if you're going
yeah,
to say like, hey, if there's one main
there's
issue,
yeah, certainly a lot of problems. So, um, we've seen, Innova Health was founded with the premise that providers needed better solutions in their hands, right? Like they needed better solutions to be able to improve patient care. And we believe as a company that if you help the provider, the clinician, in our case, the physical therapist, occupational therapist, or speech therapist, if we give them the right tools, right, then they could be more efficient with their work and spend more time with patients. If they can spend more time with patients, then they can drive better care, right? So we want them to spend a lot more time with patients and a lot less time with tech, right? It's a big thing for us. So what we did in terms of an electronic medical record, right? Like we started from the bottom up, right? We started listening more to the providers.
okay,
That's where we heard the most noise, right? It's like, no, we just need better solutions. The current solutions that we have now are cumbersome, complicated, our legacy. They take us away from the patient, and it's not just time, right? It's also
right,
like headspace, right? Like
mm,
if you're preoccupied in dealing and trying to navigate with a system that you cannot understand, and it's taking too long to enter, for example, a clinical note, right? Then your thinking is not that, it needs to be diverted to the patient, right? Like your thoughts, your thinking, it needs to be, caring for that patient, trying to understand the problems that the patient has, so you can treat that patient, right? It should not be like the power of your brain should not be going to technology, right? And try to figure out the software, right? The
yes,
software should be seamless. It should just be a tool, right? It should just be something that's enabling you to get the right data to provide care for that patient, right? So it's time and brain space, right? And that's where we're seeing a lot of the need, right, in the field of rehab within senior care, right? It's like we providers, need better tools to be able to treat patients, spend more time with patients. So that's an angle that we heard just loud and clear, right,
right,
from the market, and where we're focusing on, certainly a big, a big need, right? Um, so that's where we focused our efforts. It's more from the ground up, right? Whereas primarily, a lot of EMR technologies start from the top up, which is, well, we need, the system to be able to produce data so it can bill out, right? And that's important, right?
right,
Providers need to also get reimbursed, right? But the workflows are not so much designed, for the clinical need, for the clinical workflow, right? It's more designed towards like, let's capture the right data so we can send out the right claims, right? And that's changing a little bit too, which is something that we're really, looking at, as healthcare starts driving, more towards a value-based care system, in where we're not just going to be, collecting CPT codes and billing fee for service, right? Now there's an outcome component to the billing as well, right?
right,
And we need to be able to track those outcomes to be able to uh, look at whatever you build out, and at the same time make sure that you're getting compensated based on the outcomes that you're delivering, whether it's, for quality measures or the quality reporting program for Medicare and QRP. That's really important as well. So we're looking at that also. We want to make sure that the system can bill out, but at the same time, we want to make sure that we're tracking outcomes, and we want to make sure that the clinician is having a great experience. And why is it important for the clinician to have a great experience is because, we want the clinician to be happy, but
right,
because they have a hard job, especially in post-acute care, and where they're treating, very clinically complex cases, right? I mean, you're talking about like an 85-year-old, with hemiplegia and a stroke. They're highly complex patients. They need to really spend the time with the patient, right? Um, but at the same time, it's good for business, right? Like there's a high turnover rate, right now in therapy, right?
I
And
mean, do we have any idea of what that level of attrition is in terms of turnover? Because I mean, and do we know that if it's typically due to, let's just call it clinician burnout or
yeah,
administrative
oh yeah.
burden that's being placed on clinicians? Are there any stats on that?
Absolutely. Yeah, absolutely. They're all of the above. I think, very well said, right? So there is certainly burnout, not just in therapy, but you look at
Yeah.
physicians too, there's high burnout in
Hmm.
physicians.
Yes. Yes. Yes.
Unfortunately, there's many EHR systems out there, and that's part of that, right? Like, physicians are, getting burned out because they're seeing a lot of patients, but at the same time, they're spending a lot of time in administrative burden that is created by a system that's ineffective, right? So there's a lot of administrative burden also in rehab, right? And clinicians are getting burned out, and clinicians are quitting, post-acute care, and they're saying no. I mean,
Where do they go? Do they just get out of the niche altogether?
yeah, they quit.
Mm.
They go to work in other settings, whether it's an outpatient setting. They sometimes they quit the profession, unfortunately, and that is sad to see, right? Because especially because such a high need, especially in post-acute, right? And we need more clinicians, in our space, right? But they're getting burned out because of uh, the pressure, to see more patients. They're getting burned out because of the administrative burden, of the HR systems, right? And it contributes to that, right?
Yeah.
So we feel that if we give the clinician a better experience, at least we're contributing towards, them being able to reduce that burnout, right? So that's really important to us as well. And it is a huge problem because the labor force, right? The labor pool for the need that we have in post-acute care in terms of rehab, right? The
Yes.
labor force is already small. It's already not enough, right? It's already not sustainable, right? So we can't afford to have clinicians quit.
And when you're thinking about, let's just call it, diving into solution, is this more of immersing yourself in the world of the clinician, more from a human-centered design approach, mapping out what they're doing, and then just seeing, hey, where can we streamline stuff? Not asking you to expel any IP or anything, but
Right.
how do you kind of try to make the solution? Is it sort of, let's dive in deep to the problem, and then how much is the provider involved in the actual solution scoping?
Oh, great questions. Yeah. So we go deep, right? We try hard, like really, really
Yeah.
hard. Like we go very deep, right? So, um, you see a whiteboard here, right? We started from scratch, right? Like from nothing, it's like zero code, right? But the first thing that we did was we went out to the field and we listened and listened, right? And we listened to clinicians, we listened to rehab directors, we listened to folks in the corporate areas, because all of these type of users are entering information and using and extracting information from the system that we're building, right? So we, over the past, 2.5 years, have really had to really understand all of the use cases, right, for all of these stakeholders or users
Yes.
that we have, within our system, right? So it's a complex system, right? But from the clinical standpoint, yes, I mean you dig deep, right? Like we go out there, we shadow, we look at clinicians doing evaluations. We look at their flows. We look at their flows on the daily notes, and we really try to understand what are their frustrations, what are their problems, right? We do that also by hiring, clinicians, here on the team as well in Innova Health. I think that's a fascinating area, actually. I've seen some podcasts, and kudos to the folks that are doing this podcast on like, type of helping clinicians get into tech. I think that's super. I think that's great. I'm part of that, right? So,
Yeah.
I think we need more clinicians in technology. I think that we need more healthcare providers in technology to be able to design the right tools, right? And be able to implement the right tools in your respective fields. In our case, it's rehab, right? But yeah, so we listen deeply, we listen intently. We try to understand the problems. We try not to come up with solutions, right? Because a lot of times, folks want to give us solutions, which is fantastic, right? But we're more interested in their problems, right? Because we feel that we're pretty good about coming up with solutions. but then balancing those solutions, right, with our customers as well, right? Hiring certainly, clinicians also help, which we're doing more now, and also working with consultants, right? There's some tremendous consultants out there in the field, and you guys know who you are. Kudos to you guys, because they've helped us a lot too. Consultants that understand rehab operations, consultants that understand, clinical needs, right, and clinical workflows and all of that. So it takes a village, right? Like it takes like a lot of input, right, from the customers, from consultants, from our own people to work then with our designers, to work with our development team to come up with that magic. But one of our values here at Innova Health, which see that paper in the back,
Yeah.
our values are there, is that the customer engagement and utilization is our lifeblood, right? So that's one of our values, right? So we've engaged customers
I
from day
love that.
one.
I love that.
Yeah. So yeah,
No
customer
customers,
engagement.
no business.
No
No
customer, no
customers using
business.
your stuff, no business. Yeah.
Exactly. So that's been a driving force for us from day one. I mean, from the first prototype that we built, we bounced it off by the customer, right?
But how
And
do
it's
you
like
measure utilization?
so we build a feature and we see if people are using the feature or not, right? If people are not using the feature, then we were just full of crap and we were just drinking our own Kool-Aid, right? It's like, oh yeah, this is a great feature. People are going to use it, but like, rubber, yeah, you see that very easily with software if people are using the feature or not, right?
Yeah.
And sometimes you miss, right? But I think that in technology, it's the beauty of technology, right? So you have to take risks, right? And you have to take risks and build. And sometimes what you build is not utilized, and you got to move on. You got to fail fast, right? And not break fast and fail fast and break things like with Facebook early days.
Yeah.
Because we can't really break too many things in healthcare because it's affecting patient care. So it's a different mantra, right? But we do need to fail to be able to understand the customer. It's interesting. We've done pilots now, right? And there were certain tools that we built that we thought that were going to get utilized quite a bit, right?
Yeah.
And people are not using them, or there were ways in where we thought that people were going to interact with the software and they're interacting with it differently, right? So you have to be constantly looking at the behavior of the user to continue to iterate. So you have to build technology that is flexible enough, right, to be able to iterate quickly, right? Which is an advantage for
Like
us,
how
right?
fast are you talking about iteration? Are you talking about like agile methodology, or you're talking, weekly or 2 week sprints? I mean, talk to us about that.
Yeah, so there's a balance there, right? So at the beginning, fast is super fast, right? Like weekly, right? And we have the technology, and the teams in the process that allows us to do that, right? The problem with that obviously is that you could compromise on the quality, right, of the tool or the quality of the software, right?
Hmm.
The faster you build, or the faster you release, the higher the risk that you could introduce some sort of defect or bug or whatever it may be, right? But yeah, I mean, we're building pretty fast. We have a pretty agile. We do work in sprints, obviously, and we're now slowing down the release cycle, right? Just because we're now we're but we're still building velocity is important, right? Velocity is important because you need to iterate and you need to test things quickly, right? But the beauty of modern technology is that it allows you to do that, right?
I'm just thinking about how you mentioned customers are the lifeline and the engagement of the customer. Is there a point where you're thinking, all right, we need more customers, but we don't want to have so many customers that we can't show them the love, at least in this early stage, not early, but like at the stage that you're at now, there's a level of sensitivity. How do
Mhm.
you how do you balance that? Is that something that you're just using prior experience, a bit of intuition, instincts, gut, or is there data and
Mhm.
things that you use to kind of decipher when, you kind of put the pedal down to the floor and go, or hey, let's just go even deeper with who we have now?
Yeah. So I think I think it's different in every, any stage of company, right? Like as at an early stage, the way that you listen to certain customers, you're gonna go super deep, right? With the group of folks that you're working with. I think that as the company starts growing and scaling, you have to be a lot more selective in what you're listening and what you're acting on, right?
Mm.
Depending on the product roadmap, priorities and things of that nature. Right now, we're being very active with the feedback that we get from the few folks that we're working with, right?
Mhm.
So we're implementing, most of it, right? And then what we're seeing is, we're seeing a lot of trends, right? Like and we try to look for trends, right? So our customer success team, is looking for trends as they're working with customers, right? And we want to see what's crossing over in terms of feature requests or in terms of problems, in terms of pain points and things of that nature, right? Clinical documentation, for example, was a big pain point, right? So we're solving for that pretty hard, right? Um, Whereas I think that, so it's easier to manage now, right? As the company starts growing and scaling, I mean, you certainly need to have I think, a really good methodology to be able to
Right.
listen to the customer, right? It's going to get into a point where you cannot act on every feedback. But what I do believe is that you can listen to every feedback, right?
Mm.
Um, you can listen to everything, right? And I think that the culture of the company should be ingrained with that, right? We might not be able to act on it right away, but we listen to it, right? What's coming from customer support, for example? That's valuable feedback, right? Like if I know that a feature is you know we have tickets for a particular feature that is not necessarily broken, but we're getting calls on that feature all the time. Well, it's not intuitive, right? There's a
Mm.
design problem. There's a design flaw. People are asking why are you using that? Like how do you use that, right?
Mm.
Or if you're getting, a call for something that's buggy, that's breaking all the time, right? You're starting to see these trends and this feedback, right? So that's one channel of feedback, right? That's
Mhm.
customer support. Customer success, you see a channel of feedback there as well. That's more strategic, that's more forward looking, right? So customers looking at, you know, I was a conversation with a customer that's really, really deep into QRPs and quality measures, for example. Really, really important stuff, right? That we can do a lot of help with, right? But it's more strategic in nature. It's more forward looking, right? So we'll listen to that, right? Um, there's many channels, right, like that, right? Whether it's we meet with the customer for a QRB, right? So there's always feedback, right? So I think that whether it's customer support that's taking in that feedback, whether it's customer success that's taking that feedback, or the product team that's taking that feedback from both of those teams, right? Or sales and marketing too, same thing. I mean, I think that sales is also there to understand the market, understand the needs of the market, not just to push product, right?
That's right.
Uh, so that's also invaluable feedback for us, right? We want to hire salespeople that really are curious, they understand and are empathetic, towards the folks that we're trying to help out, right? Because we don't want to push a solution just for the mere sake of pushing a solution that we can't help a customer, right? So that's another channel, right? So you're always getting feedback, and that's the beauty of software, that always getting feedback, right? You just need a really good system to be able to collect all this feedback and implement on what's really important, right?
Mhm.
And looking at those trends. So it does scale. I mean, you could scale it, but it takes a lot of methodology. And I think that it also takes a culture that that wants to really listen to the customer, right?
Yeah.
That really wants
Yeah.
to understand the customer's pain, right? So we hire a lot of our hires, whether it's from development to customer support, we screen for empathy. We're actually screening for empathy. Even our CTO screens for empathy, right?
Yes.
Because we want people that really understand, like that listens, right? They're empathetic, right? So we can build better tools.
When you mentioned culture a few different times and the importance of it, I'm curious, what are some of the other values that you and the team are driving? And I guess
Mhm.
talk about those, because my hunch is that they somehow transmit over to the customer, and the customers then become raving fans. And my assumption is just like, maybe it's more like product-led growth in the sense that people start to
Mhm.
love working with Innova. And just talk a little bit about that, because it seems as though that's like a really important thing for you and has been for some time.
Yeah, it is. It's super important. Super important to not to me, but just to us in general at Innova. It's interesting you mentioned product like growth, right? Because that's bottom up. Like PLG is a strategy that SaaS has
Yes.
been used for a while now. It's nothing new, right? Like this is
Hmm.
how Dropbox, really grew. It's PLG, right? It's like from the
Yes.
bottom up. I've been thinking a lot about the concept of therapist-led growth, right?
Mm.
If we can have therapists fall in love with a product, right? That'll be a
TLG.
great PLG, baby. That's right.
It
That's
happened here.
right.
You guys just saw it. It
Yeah,
happened right here.
that's right.
You coined it.
That's a trade secret, man. Come on, you can't. That's fine. But I've been thinking a lot about that, right? I've
Yeah.
been thinking a lot about that because one of our core values, right, is uh, it it's build products that people that people love, right? Now, you don't wake up every day and be like, oh my God, I love my EMR system, right? Like I can't wait to go there and use my EMR system, right? But if we can have a clinician, go into the field and enter a clinical node, not think about the EMR system, right? Just think about their patient, right? At
Yeah.
the end of the day, they're gonna sit back and they're gonna be like, wow, yeah, I love that EMR system. That's really good, right?
Yeah.
So that's
Yeah.
one of our values, right? One of our values is like build products that people love, right? And that's really, really important for us, right? So that's definitely a core value, for Innova. We mentioned the customer, feedback, utilization, right, being the lifeblood, right?
Mhm.
Um, we care deeply about not just our customers, but we also care deeply about the people that work for us, right? So we have people all over the world, right?
Yes.
And we care, right? Like it's not. I think that if you don't care for your people, you can't care for the customer, right? So it's got to go, it's got to go hand in hand, right? It's just like you can't build great product if you don't have a great customer experience, or you gotta be able to do both and support
Yes.
both. So for us, yeah, we deeply care about our customers, but at the same time, we deeply care about the people that we bring on, right? And want to make sure that we build a company that allows for opportunities for growth, that allows for opportunities to thrive, right? And that's really important to us, right? That's one of the reasons, why we decided to build Innova Health too is because that excites us, right? Like how do we build a place that's awesome to work for, right? Um, and we're not perfect, right? But we aspire to do that, right? Um,
Right.
that's really important to us as well. Just as important as the product is, right? Just as important as the culture is, right? Just as important as our customers are, right? So, um, best ideas win. We're very transparent. Transparency is one of our cultures, in our culture, and best ideas win also, right? So those two values kind of go hand in hand. We care about each other. We respect each other, but we want to be frank with each other, right? We want to be direct with each other. If something's going well, great. Something's going great. If something's not going well, let's have a discussion. Why not? What's going on?
No.
Like, what can we do to address it, right? But be transparent about it. Be able to talk about it. That transparency is important for us to be able to grow as a company. And we're very flat. Like we're not. I think one of our superpowers, right, is that we're as an early stage company, speed, right? So we have no tolerance for bureaucracy, right? We don't just tolerate it, So we're as a place in where the best ideas win. I don't care if it comes from somebody that just joined the organization, somebody that's super junior, somebody that's in our leadership team. It doesn't matter. The best ideas always win. So those are some of our few values. That we have 8 values. I don't want to go through all of them,
We're not
but
going to go through all of them, but I think it's important to kind of note like the bloodline of the organization, why
yeah,
you're doing what you're doing, and I think you've articulated that well.
yeah. Mhm.
Again, you're at such a pivotal moment in the journey of Innova Health. Realistically, I mean, how far out can you look? I know you're a visionary and you're a strategic thinker, but you're also an executor. What's the
Mhm.
balance for you? I mean, how far out can you actually look
Yeah.
realistically?
Yeah, so we look pretty far. We like to look far, right? Because we wanna make a massive impact, right? That's really what drives us, you know.
Hmm.
That's another core value, by the way. Big challenges, like we don't back away from big challenges, right? Because big challenges breed opportunity, right?
Yes,
Like building
yes.
this thing from scratch was a massive challenge, right? But that's who we are. It drives, like the bigger the challenge, the more it excites us, you know. But big challenges, they take a long-term outlook, right? Uh, so you have to have a long-term outlook to that,
Hmm.
to that challenge, right? So we have lofty goals, right? We're gonna be here for a while,
That's right.
um, and our roadmap for this year, it's we see it as a very short-term window to what's coming ahead over the next 5, 10 years, right? So we need to be able to look far ahead, right? uh, because otherwise we don't get the fuel that we need to get up in the morning and do the things that we do, right?
That's right.
Um, it's that's really where the mission comes in, the vision comes in, is what allows us to wake up in the morning and say, yeah, we want to build this stuff. And, gosh, I have another call at 4 in the morning with design and dev to talk about this button, right? But that's not that exciting as being able to help providers deliver better care by, helping them spend more time with patients, right? So that
Yes.
when I hear that makes me excited. But that's a long-term outlook, right? In the meantime, we got to execute towards our goals. So we have to be very, very disciplined, right? And that's, we need to have that discipline to be able to hit the
Right.
short-term goals that we have, right?
Mm.
And so in that sense, we have to zoom out and then we have to zoom in, right? And you zoom in tightly, right?
Mm.
And you have to be very disciplined. This is why I don't call you sometimes, Michael, as much as I love you, because
Hey,
we're
I know
we're
you
very
gotta, you're in the zone, man. Let's go. I know.
so you have to be in the zone, right? Because
Yeah.
otherwise, you don't get the shit done, and you gotta get the shit done. Sorry, I know
Yeah.
I'm live here,
Yeah,
but
it's okay. We're not going to get roasted or anything because of that. But
yeah,
so I
yeah.
guess kind of rounding out where we are, um, there's a lot of other founders that are in our community that are kind of on this journey. If
Mhm.
there's one action item that you would say, hey, this is this is what I would take action on, what what would that action item be?
Man, one, that's hard, you know.
All right, if you got
I
two,
would say
we'll take two.
I'll give you a couple. I would say surround yourself with the best team possible. Surround yourself with great people, right? Uh, Leave the ego aside and just if you have the funding or whatever, just hire the best people that you can. You don't want to be the smartest person in the room. If
Yeah.
you're the smartest person in the room, you know that you didn't hire well, right? So that'll be number one, right? And number two, we've talked about this a lot, in terms of, at least from a product philosophy and a business philosophy, understand the customer's problems before you do anything, before you build anything, right? Uh, because if you don't, you're gonna build something that people are not gonna use,
Mm.
and then you're done. Then the game's
Yeah,
over,
game's
right?
over. Yeah,
Yeah. So you really
right.
have to understand, the market that you're going after. Really understand the problems that you're trying to solve for, right? At a very, very deep level, right? And solve for that. And if you can't find problems, then don't build solutions,
Yeah.
because otherwise people are not gonna use whatever you built, you know, and that's a big problem. Yeah.
And so, I mean, you've spoken a little bit about Innova, but I mean, how can folks continue to follow your journey, follow your company's journey? Maybe just kind of give a little bit of a commercial about what you guys are up to and how people can kind
Sure.
of follow along.
Yeah. So if you're passionate about healthcare and technology, about the seniors, senior care and senior rehab, whether it's in skilled nursing or senior living communities, you know, uh, uh, you can follow us on LinkedIn. We have a page on LinkedIn. We do a post there, every now and then. Feel free to connect with me on LinkedIn. That's good too. Our website is innovahealth.com. Every now and then we'll post there, for positions that we're trying to fill or that we're trying to hire, you know.
Yeah.
But yeah, that's it. I mean, right now, you know, we're primarily focused on, you know, on building things, you know.
So let's just say, last question. Let's just say we're doing another sit down a year from now,
Mhm.
and we're looking back. What
Yeah.
what needs to happen in order for you to feel really good, really satisfied with the progress of the company?
Yeah. So first of all, I think, you know, a customer base that loves the product, right? I think that goes without saying, you know, for any, you know, software or any, you know, any company for that matter, right? Like what's the point of building something, whether it's a service or a product, if people don't love what you built, right? So to me that's really important to us. That's really important, right? That our user base it's really really happy with what they're using, that is really solving problems for them, that is helping them, you know, from a clinical standpoint, you know, spend more time with patients, right? And if we can get data, you know, that will support that, you know, a year from now, and we can say, yeah, you know, therapists are spending more time with patients, that's a huge win for us, right? If we can say, you know, we can help, you know, rehab directors and operators manage their operations and their business better, you know, with our solutions, and be able to feel good about their operations and their businesses, you know, through our solutions. That's success, right? That to me is the customer success, right? With the utilization of our product is our success, right? So that's one, and the other, and I think they're equally important. Just, you know, I could have said this one before the other one, but making sure that we have just a kick-ass team, you know, that we're hiring the best people possible, and that we're driving excellence. You know, I want to, you know, we want to have a team that is driving excellence, that can execute, that can have fun at the same time, right? That to me would be huge. We do have a rule at Innova Health, and that uh, can I say another bad word?
Of course,
Yeah,
it's your episode. Go right ahead.
awesome. So we do have the no asshole, right? So we hire no assholes, right?
Hmm.
Because we do hire assholes, you know, then that could affect not just the dynamic of our team, but how we also interact with customers, you know. So those two things, I think those two things would be to me. If a year from now you ask me, hey, are you winning? Are you succeeding? I think those two metrics would do it for me.
Love it, love it, love it, Luis. It's been amazing having you come on, and obviously, you know, the door is always open for you to come back. And for those of you that have listened to this conversation, if you found it helpful, if you found it inspirational, would you mind, you know, showering it with a little bit of love? Whether it's commenting on things that you found to be useful, what are you going to apply, and even just resharing it with your network. So we talk about having a community of innovators, but it's really about like executing and doing. So looking forward to it. Catch up with you soon, Luis. Thanks, man.
Thank you, Michael. It was a pleasure. Bye.